Hi, my name is Amy Christensen and I'm the current chair of the Reach for Hope section for suicide prevention in Southern Utah. I'm also the current inpatient director for Intermountain Healthcare here locally in St. George. The coalition first started by, like any other movement, with concerned citizens coming together to organize around this very important topic. Those involved were from concerned citizens, they were family members of those with mental illness, as well as suicide survivors themselves. And one of the first things that was done was Lynn Bjorkman, one of our very concerned citizens, came together and organized this group into a coalition. So he was very critical to the success and the movement forward of this coalition. He reached out to Dr. Greg Hugnall and also Reach for Hope Utah to get ideas on how to organize, where do we start and how do we move forward. So as they did that, Dr. Hugnall did come down and talk to the group and brought the ideas and said, let's organize around three main areas, which we started our journey. So those three areas were around prevention, intervention, and postvention, with prevention and awareness being our key focus over the last few years. One of the first things we did and the first goals that we had around prevention was to work on getting the community trained in QPR, which is question, persuade, refer. QPR is thought to be the CPR of mental health, specifically for suicide. One of the key points that we emphasize as we're doing this training is that it's really okay and we should ask people, are you going to hurt yourself? And if so, how? And if they're thinking about that, and if they have a plan, you need to stick with them and support them in getting the help and finding resources in the community so that we can prevent and hopefully get them connected to services. It's that trajectory where you can make a difference in someone's life. And so that's been one of our main focuses and goals this year. And that's some of the other things that we've done as a coalition. We're actively involved every year in Suicide Prevention Week in September. We help support the Out of Darkness Walk. We have sponsored panels for speakers, suicide survivors, and others that can bring that awareness to the community in a way that we really need, for people to realize that it is a problem in Southern Utah, and we need to address it, and we need to be aware. Some other things that we've been involved with are sponsoring and helping to do special screenings for the filming of All These Flowers. And that was specifically around reducing the stigma around mental health and homelessness. And it was really a great opportunity for us as a community to bring that awareness out through film in this documentary. It was an excellent opportunity for us. We also have our Hope Squads in the schools, and what they're doing is absolutely incredible, and we have to give credit to Therese Lilly for her work in organizing that. They're very active groups, and they are making a difference for our young adults in this community. So excellent work that's being done there. Our current coalition is made up of community partners from St. George Police Department, Washington County School District, Dixie State University, Intermountain Healthcare, Southwest Behavioral Health, our Native American community, our Veterans Administration, and our Interfaith Council. We have many active people involved in this effort, and we continue to move that forward. One of the goals we have this year for the coalition is strengthening our coalition by bringing on a key leader board. And with that, we are inviting key leaders from the community that can help bring this awareness and bring resources to this very important topic. And that would include the mayor, St. George City Mayor, Washington County Commissioner, as well as the medical director of the Southern Utah Public Health Department and the administrator at Dixie Regional Hospital. So we are excited about the work, and we are optimistic about the work that is happening going forward. with this. If you should be watching this film and want to get involved with the work that's happening with our coalition, please contact us at 634-5600, or you can get online at reachforhopeutah.org. In addition, if you're struggling with mental health issues, please, there are resources in the community. You can contact that same number, 634-5600, or you can also contact the Utah Suicide Prevention Hotline, which is 1-800-273-8255. We also have NAMI, very active in our community. That's the National Alliance for Mental Illness, and they have free groups that you can get involved in, that you can go to, that your family members can get involved with. So there are resources for you in the community.